So now let's get into dental wonders experienced in part from learning to use red and infrared during bursa prevention. In 2020, just before the COVID shutdown, I had a full mouth twin light laser gum surgery for gingivitis. This is done in place of the older, more popular endodontic cutting away of the gums, which doesn't really work anyway. A minimally invasive periodontal treatment that uses one laser to remove diseased gum tissues and another laser to promote healing. And if you want to grab a screenshot of this is all the information. I expect those folks that are interested in light therapy, this would be a very interesting topic for you to have a close look at. It absolutely worked beautifully. These aren't my pictures, but the before and after differences are stunning. The gums are very puffy when you have gingivitis, and they tighten up really nicely, and the bone grows in really nicely after treatment. And this was near immediate. I had a brand new mouth. It was just incredible. So in my mouth, I do have a crown. It's called a bridge. And in this bridge has what is a socket in between two of the existing teeth. So you pull out a tooth and you have two existing teeth. You attach the bridge that way. And this is what it looks like at a cross section. So a couple years later down the road, just before mom's thing, I'm having some CBD oil, very low THC, so you don't get dingy from it, but it's excellent CBD oil. And I didn't realize the cap was slightly left open, or I didn't realize that was an issue. So the cap was slightly left open, put it in my mouth. It's supposed to be lingual, right? So I'm swishing it around my mouth, And then unfortunately, I swished it into the little space here in the bridge area. No good. And then I realized that, if you leave a cap off of CBD oil, it goes bad right away. It oxidizes. So I didn't know that until I looked it up and I knew exactly what happened. I was like, oh my gosh, here I am a couple years after my twin light therapy and I've got a puffy gum inside there. And so it's up here on the far right-hand side. The first thing I did is I reached for Dr. Tent's favorite, Thymoimmune, which is essentially God's version of an antibiotic. Really, it's powerfully building up the immune system, and the thymus gland is the master gland of the immune system. Instead of kill, it's actually building up your immune system, and that actually worked perfectly. The infection, everything went down real quickly, but then it came back, and I had to do Thymoimmune again, and then it came back again, basically at the same intensity each time, and this was during the first trip to mom's house for the stroke, so that was a very awkward time for this. I could feel puffiness in the inner gum with my tongue when it would start to inflame. Thymoimmune, I kept using, rinse, cycle, repeat, kept using it. At this point, an additional sensitivity formed here on the outer part of the gum at the tooth line. When I'd brush, it would actually start to be sensitive. Running low, of course, on Thymoimmune at mom's house. I asked myself the question, what if I handled this with the Firefly when I get home? I was really missing my Firefly. I had no intention of staying with mom for 2 months. I didn't realize she was going to have a stroke. I didn't realize it was all just going to go downhill. So then I'm pulling out my documentation here, which we all got when we first got our Firefly wellness, but you can see I've copy-pasted on a bunch of the frequencies that were also included if you click the links that were provided for you. So you all might want to take a screenshot of that just so you see what all the additional little types of items are hit by sources 3, 4, and 2. And so as I'm looking at this sheet, taking it all in, I notice right here, bacteria, that's pretty much what's up in that area. So source 2 is what I plan on using when I get home. So I get home and I'm like, all right, how am I going to do this? I'm going to put a bacteria-filled finger inside my mouth, and with my other right arm, my 2 right arms, I'm going to power it wasn't going to work. So I had to rethink this, and that's good. Once in a while, the challenges are excellent. So I figured out that's what I need. I need to get a Langenbach retractor. $12 on Amazon, by the way. And so the way that I use it is I use my left arm. Let me get my Firefly here. So what I do is I take my left arm and go under. And you're going to need to be able to get to these switches to turn the blue light off when it gets too hot, right? So that's it, okay? Use the opposite hand to do your smile, and then the right hand to paint, okay? Pretty easy to do. Worked out wonderfully, I will say. So I used intensity 4 and source 2, and the timer I set to 2 minutes, because as you do this for 2 minutes, you start to drool. You're going to drool down your chin. It's going to get wet. It's going to get a little funny. And so you just basically restart in another 2-minute interval. So I'd go in 2-minute intervals to manage the situation. While I was doing it, I'd have the blue light on, turn the blue light off, turn the blue light on again, and then I'd get these hot spots on the inside of the lip And at that point in time, I turned the blue light back off again, understanding that the target was pretty deep. I was looking for a deep target, so it didn't matter that I had blue light off quite a bit. And so I painted outside in two-minute intervals for 4 minutes, and then I'd paint on the inside for 4 minutes, and inside is much easier. You're able to get up there with the light. You just kind of have to eat the Firefly wand a little bit, which is no problem. Sure enough, started going away. Resolution was rapid and lasting. It only came back one time at a greatly reduced degree, resolved never to return again. Interestingly, sensitivity actually resolved first. Then the gum inflammation came down. I found that to be quite interesting, especially when you discover that a tooth, which you normally think of as solid, is actually not solid. It's made up of all these microscopic tubules. It's actually completely porous all the way through it. And stuff can get inside these porous tubules, and that's where the Firefly really starts to do its magic. So months later, I'm flossing and a sensitivity develops in tooth number 20, second bicuspid at the base as I'm flossing. A mercury-based crown was recently replaced on this tooth. I did the exact same Firefly protocol as I had done previously, and within a couple sessions, sensitivity went away. However, a few weeks later, the sensitivity returned, but only on the inside of the jaw this time, where I could not get to with the Firefly. So how am I going to get a Firefly to get the back of this tooth? Thinking to myself, well, this is another head scratcher. All right, how are you going to figure this one out? So, yeah, it was the backside of tooth number 20 on the inside, like the place that the light was not getting to. Figured it out. So I then deployed a small dental mirror that came with a water pick I had purchased. That's this little guy right here. And I also got a big one. Both work amazingly well to reflect light. That's really all we're trying to do, right? Reflect light. So then I put a little mirror guy in the mouth, and through the reflection, I can actually see the back side of the tooth, which is actually what we're really looking for here, right? So if you can see it, paint directly in line with your sight. Okay, you're bouncing it off the mirror and you're hitting the backside of the tooth. Very easy to do. Of course, you're standing in front of a mirror, so this is a two-way kind of thing. So again, the wand is facing inside your mouth, right? You're actually pointing it towards your mouth, and the mirror, of course, is back there. So you target the location, you see it. Once you see it, you can actually then paint right onto it. And that was it. It's great. It worked perfectly. And you can actually feel the heat. Again, I'm using intervals of blue light in here. I'm not going as much with the red light. I'm using a lot of blue as well to topically get that because it's a sensitivity. And you can feel the heat on the inside of the gum. So when you use the mirror, you can actually feel the heat building up, which is a perfect sign you're in there. So intensity 4, source 2, 2 minutes at a whack because you're going to drool the whole time, and then you can clean up in between or whatnot, or just hit it again and get it going. And so it was on and off blue, mostly blue. I left it on mostly for this one. 2 minutes plus 2 minutes so you can manage it. Inner sensitivity fully resolved at the full digging of dental floss in the area, which is exactly what I was looking for. Sensitivity of both inside and outside returned one time. It seems to be a theme we've talked about here. Right? Firefly sessions then resolved it completely, which is what we're doing here. So it doesn't matter what it is. If you have an issue, just understand you want to work the cycles. You want to work the cycles, you want to work the cycles. Quick fixes are an unrealistic expectation. Work the cycles, work the cycles. So let's talk about root canals now. This is a very important topic because bacteria actually controls coagulation in the human blood. Bacteria can directly initiate coagulation in the human blood. Did you know that? So when you have a root canal, you're deadening the tooth and there's no way for it to clean out these tubules. You end up with a bunch of this bacteria in all those little tubules of your teeth of every root canal that's in your mouth. And so I was told and followed through to get a 3D beam scan, which is a type of x-ray that produces a 3D image of the mouth, jaw, and surrounding structures. And I found the problem teeth, and I was able to treat those pretty easily with what I call palpate and paint. In this case, I'm doing source 2 with intensity 4 at 5-minute intervals. And I'm only using red and infrared so I can actually get right on to the jaw. And so what you would do is you'd go and you'd feel through, and I knew because of that 3D x-ray, you go feel where sensitivities are. I felt a little sensitivity up there. It's no longer there. Had a couple sensitivities down at the bottom, of course. Those are no longer there. You just put it right on there and you leave it. And you paint with red and infrared and 2. And what you're trying to do at this point is you're getting through the jawbone and you're getting into the teeth. And you're getting all of these little tubules that are filled with all sorts of fun little guys. And it works absolutely well. So if you have a root canal, your tooth actually starts to form a barrier out of it. It's actually your immune system begins to form a barrier. And these are usually the puffies that you can touch and feel. And if it's puffy at all, just start to do a little Firefly treatment on it. It'll be a very good thing. And so make sure always that when you're treating yourself for any type of bacteria, use vitamin C the way it's supposed to be used. The key role for vitamin C is like a big distribution of garbage bags to then easily facilitate the removal of refuse. That's what vitamin C really does in its most simplistic form.